I always say I was marching before I was walking. And in fact, I was. So before I could even walk, I was on marches in Washington, in Albany, sometimes in California with my mom. She was a major player in the women's movement here in the US. And she was very focused on making a statement. And this was really connected to a core concept in Judaism. The concept in Judaism is called tikkun olam. And what it means is to heal the world, to make the world better. And the notion is that we have an obligation to leave the world a better place than when we came into the world. I actually spent 5 years of my life before going back to graduate school as a documentary filmmaker. And one of the things that we talked about was that in the US, the complexion of our society isn't just one archetype. So it wasn't going to be enough to just talk about white women and breast cancer. And I, using my anthropological background, had suggested perhaps in the US we need to work with Latinas and Black women and Chinese women and Jewish women and Native American women, and because they all have different belief systems, and therefore how and when they access care or not is going to be different. And so these messages and this lived experience became really, really important. The notion of being able to tell stories and using the storytelling and the lived experience to raise awareness, to then hopefully improve diagnosis, to then hopefully improve outcomes, and ultimately hopefully save lives. In the world of health equity, we always use data, and data is critically important. Underneath all of that data, however, are also lived experiences. And if we don't uncover the lived experiences and listen deeply and empathically, we're not going to know what the root cause of that data story is. A dear friend's dad one day said to me, Jen, if you really want to make a dent in healthcare in this country, which is, and then was so broken, he said, you've got to understand the financing. Fast forward, I was fortunate enough to be accepted at Columbia Business School. And so then I was at the public health school and the business school. And then I ended up at Deloitte from business school. And I came right into the healthcare practice, the life sciences and healthcare practice, and have been doing that work ever since. It's coming up on 25 years now. As I think about the future of health, one of the things I'm most excited about is equity, that we are really working to build and working together to build a more equitable world of health and health for all. And so as we think about what does that mean? So some of the shifts, for example, are shifting from sick care to health and well-being, shifting from what is essentially still a provider-centric healthcare system to a consumer-centered way of accessing and engaging in health. The data is interoperable and available, and I have it right here in the palm of my hand. My mother used to always say to me, you're never going to be remembered for what you did at work. You're going to be remembered for how you made people feel and how you showed up. And I think there's a lot of sense in that. I hope that people will remember me as one of the people who was able to build a sustainable organization that's woven into the fabric and funded forever and ever and ever. And so democratizing the data, creating equity so that we all can raise health together for all populations.